Spokane, Washington opened a new medical respite facility earlier this week as part of its scattered site homeless model, sparking support and criticisms from the city council. Tim Klauser with the Center Square is here with more. Tim, tell us about this new facility and how it fits into the new model Spokane is shifting to.
Yeah, this new facility, they're calling it a medical respite facility. It's located out of a church kind of on the fringe of the downtown's core, but it's essentially set up for people to be referred to from a nearby hospital just a few minutes away. So it's not low barrier or open to anyone. You can't just walk in. You have to get those hospital referrals. So there's 30 beds there. I'm not sure if there is limits on how long they can stay or what those would be, but it's essentially set up for people that are needing recuperative care. Now, this is people that have chronic and acute ailments, whether it be from substance abuse, mental health disorders, or physical ailments, things that they just can't take care of themselves. So the idea with this facility is to stop the cycle of people, high utilizers sort of taking up that emergency room space. They do need that care, but it's important that those beds are also available for other members of the community coming through. So having this facility provides another place for those people to go and get that care while also making sure that these other beds are available for the rest of the facility. But in terms of the whole model as a whole, we've talked about this the last few months, but Spokane is transitioning from a more congregate style of homeless shelters and its homelessness system in general towards a scattered site model, which is essentially having a bunch of different homeless shelters and services that can cater to around, say, 20 to 60 people of a more targeted portion of the population. So you can cater better to their needs. So they have a few sites open around the city. They do still have some congregate models that they're working to wind down operations moving forward so they can move completely to the scattered site model. But the respite facility is that next step. Right now, I think there's about 170 beds total. There's three scattered site shelters right now, two in North Spokane that are run by Jules Helping Hands, which used to run Spokane's Camp Hope, and then another one by Truth Ministries. So those, I think, have a collective of 110 or 120 beds. And then the city's navigation center, which is essentially the first shelter that someone needs to come in before being directed to the other shelters or services, that provides another 30 beds. And the respite facility, though it's not a homeless shelter, also provides another 30 beds. So I think they're sitting around 170 right now. There's two projects in the pipeline that they're hoping to get approved. And I think they said that that would take the total bed count among the scattered site model to 205. There are hundreds of other beds throughout the other shelters in the city.
And Empire Health Foundation President Zeke Smith updated the city council on the opening of this facility earlier this week. How did they respond?
Yeah, so the entire city council surprisingly was relatively in support of the facility. They said these services are essential and Spokane needs them, but they also spoke on the importance of the process to site these facilities or to pick the location where they're going to open up in. In this case, the facility was opened up in a church downtown, but it's directly across the street from a high school. The city council didn't have much word of this, or at least the city council's conservative minority didn't have much time about this. Julie Garcia, who runs Jules Helping Hands, she actually told me a little over a month ago that she planned to open this facility with the city as part of the scattered site model. Now, Jonathan Bingle, one of the conservative minority members on the council, he didn't learn about this until 2 weeks ago. He said the city didn't tell him anything. He heard from Garcia. So he kind of just spoke on that lack of transparency, which the progressive majority pushed back on. I mean, I'm looking at a story I wrote yesterday, and I'll read this quote. It says, "I understand the business owners and the outreach, and when we have really tried to engage them, the pushback has been so fierce and not quite correct information," said Council President Betsy Wilkerson. "I think EHF, Empire Health Foundation, did a good job in the window of time they had to get this out there. I don't know if it's our responsibility to inform every single person, every single business as much as we can. I think it's important to note also that this facility opened at the beginning of this week, but the city announced its opening less than a week before that. There wasn't outreach much at all with this project. There's a $60 million building being built right next door to it as well, and the developer was not looped in on that. Now, is he required to? Are they required to do that outreach? By some means, yes. But that's the conservative minority's issue here, is that they want that transparency to be there. And Councilmember Cathcart, who's part of the minority, he proposed an ordinance months ago which would require good neighbor agreements, which are a contract between the city, the provider, and the local neighborhood council to uphold certain standards so the rest of the community doesn't suffer as a result of this new service. Now, the progressive majority tabled that ordinance and said, look, that's just going to make it harder to site these facilities, and this care isn't going to be done. Now, the minority is arguing, look, we need this siting process because these services are essential. We need a rigorous process to make sure that they're meeting standards, especially when they're placed right across the street from a high school with about a week's notice.
And how does this kind of tie into the larger sentiment of the city around the homelessness issue?
Yeah, homelessness has been a big politicized issue in the city as of late. I mean, I've been covering Spokane myself since April, but the issue has long been there before. Um, it goes both ways. I mean, the issue is really bad downtown. It's improved by some means over the last month through the implementation of a core program with increased police presence, but there's still disproportionate amount of homelessness in the area, open air drug use. The trends are up and down with violent crime and property crime. But the narrative that you hear coming from a lot of the businesses and people that live downtown is that they just don't feel like it's worth calling the police anymore. That when they do, it's often over an hour before an officer gets there, and sometimes they don't even do anything at all. Now, others have pushed back on this. I think it's important that while the progressive majority may have taken steps in the opinion of the conservative minority that silences their dissent, they're also representing a large part of the city. While the downtown area is upset with how things have gone downhill and the state of public safety in general, there's a large portion of the city that thinks that a vast majority of these services should continue to be opened up wherever they can to cater to this portion of the population. So I think it's important to note that balance between the two, that while there are issues with dynamics among the city council and the administration, both sides are representing their constituents.
Well, Tim, thank you for your insights on this story. Listeners can keep up with this story and more at thecentersquare.com.